We've engaged in health and wellness for our employees for several reasons. One, healthcare costs continue to spiral. Our revenue stream is not spiraling, and our board is committed to keeping our costs very affordable for students. So our challenge was, how do we continue to invest in our employees and at the same time not overexpend on the health benefit side?
We have currently about 70% of our full-time employees that are active participants in the wellness program. That's about 268, 270 employees.
Getting our employees excited and enrolled in the program was not a piece of cake. There was some suspicion, a feeling of intrusiveness that we were going to try to find out what their problems were, and we were going to fire people. I mean, there were all kinds of rumors. I wouldn't say that it was a huge problem, but there were certainly issues out there.
As over the last 3 years, as the program is rolled out, we've had probably a dozen folks who have stepped forward and said the results they saw in the biometric measures, for example, triggered them seeing their physician and have averted some major health issues as a result. This is kind of funny because mostly these are men who don't go to their docs very often, and when they chose to participate here, a number of them, more than 10, have come to me and said, you know, if I hadn't had this checkup, I probably would have gone sailing along until some major health episode came.
We have a faculty member that I hadn't seen for a while, and I was in the hallway, and he was coming down toward the fitness center, and I honestly didn't recognize him. I hadn't seen him for maybe 6 weeks. And I looked at him, and I kind of looked, and I said, "What have you done? You look so great, you're buff." He said, "I'm working out in the fitness center." And he said, "Let me tell you." And he went on to tell me what changes had taken place. He'd lost weight. He was feeling better. He was feeling less stress. He went in to see his doctor. The doctor couldn't believe the change in his cholesterol.
The greatest potential over the long haul is sustainability of the program, keeping our healthy people healthy and making as many gains as we can with those employees that have been reluctant. Over time, as our new employees come in, I think we'll see an improvement in participation levels.
What we're doing in health and wellness at Kalamazoo Valley Community College is helping our institution keep our healthcare costs down. It helps with your morale when you have people that feel good and healthy It helps. It's wonderful. It truly is wonderful when you see employees that lose weight and start looking at themselves differently, that came in with 4 health risks and now have maybe 1 or none. Employees who take pride in doing this on their own. It gives them a whole sense of confidence that they didn't have before. That in turn makes a difference in how they do their work at the college and how they interact not only with each other, but with our customers, which are our students and our community.